Every night while you sleep, your brain runs a cleaning cycle. Not a metaphorical cleaning cycle, a literal, physiological, precisely orchestrated biological process that flushes toxic proteins out of your brain tissue, repairs cellular damage from the day's metabolic activity, and maintains the vascular health of the blood vessels that carry oxygen and nutrients to every neuron you depend on for thought, memory, language, and movement. When this cleaning cycle runs properly, it reduces the accumulation of the same proteins that researchers consistently find in the brains of people with Alzheimer's disease and vascular dementia. It reduces the microinflammation in the small blood vessels of the brain that is one of the primary drivers of stroke risk over time. It maintains the health of the brain's vascular endothelium, the inner lining of the blood vessels, in a way that no waking activity fully replicates. When this cleaning cycle is disrupted, either by poor sleep quality, by sleeping in the wrong position, by going to bed in a state of physiological stress that prevents the deep sleep stages this process requires, or by habits in the hours before sleep that undermine the transition into the restorative sleep phases, the consequences accumulate silently over months and years into a measurably elevated risk of stroke, cognitive decline, and cerebrovascular disease. There is one specific nightly habit that supports this cleaning cycle more directly than any other. It is free, it requires no equipment, it takes less than 5 minutes to prepare for, and the research behind it, published in peer-reviewed neuroscience journals, is some of the most compelling evidence for a behavioral stroke risk reduction strategy available in the current scientific literature. My name is Dr. Favor Clinton. I have over 10 years of clinical experience, and brain health preservation after 60 is one of the areas I am most committed to making accessible and actionable for the people who need it most. Today, I am going to give you the nightly brain habit that could be quietly protecting your brain every single night for the rest of your life, starting tonight. To understand why the nightly habit I am about to describe works, you first need to understand a system that was not even known to science until 2012, and that is still not widely discussed in standard medical appointments, despite its profound implications for brain health and stroke prevention. It is called the glymphatic system, and it is one of the most significant neuroscience discoveries of the past 2 decades. The name combines glial, referring to the non-neuronal brain cells that form the channels of this system, with lymphatic, reflecting its similarity in function to the lymphatic system that clears waste from other tissues in the body. Here is how it works. During sleep, specifically during the deep, non-REM sleep phases, the glial cells of the brain shrink in size by approximately 60%. This shrinkage opens up spaces between the cells that are dramatically wider than during waking hours. Cerebrospinal fluid, the clear fluid that surrounds and cushions the brain, is pumped through these expanded spaces by pulsations of the arterial walls. As it flows through, it picks up metabolic waste products that have accumulated in the brain tissue during the day's activity. The most important of these waste products are amyloid beta protein and tau protein. These are the same proteins that accumulate in the brain tissue of people with Alzheimer's disease when the glymphatic system cannot clear them efficiently. Research has established that inadequate glymphatic clearance is one of the primary mechanisms through which these proteins accumulate to pathological levels. But the glymphatic system does not only clear Alzheimer's-associated proteins. It also clears inflammatory cytokines, the chemical messengers of brain inflammation. And chronic brain inflammation, particularly in the small blood vessels of the brain, is one of the most directly documented drivers of cerebrovascular disease and stroke risk. A glymphatic system running efficiently at night is a brain inflammation system being managed and suppressed every night. A glymphatic system running poorly is brain inflammation accumulating unchecked. The question that the research has been answering over the past decade is, what can people do, specifically and practically, to support the glymphatic system during sleep? And the answer has converged consistently on one primary behavioral factor that is more influential than any other: sleep position. I want to tell you about a patient I will call Josephine. Josephine was 68 years old when she came to see me following a TIA, a transient ischemic attack, that had occurred 4 weeks earlier. She had been assessed by neurology, her carotid arteries had been imaged, she had been started on appropriate secondary prevention medication, and she had been discharged with advice to manage her blood pressure and reduce cardiovascular risk factors. What the neurology discharge summary did not address, because it fell outside the standard TIA management protocol, was her sleep. When I asked Josephine about her sleep at our first post-TIA appointment, what she described was a pattern that I have come to recognize as one of the most consistently overlooked dimensions of cerebrovascular risk management. She slept on her back. She had always slept on her back. She slept lightly, waking frequently, and almost never felt genuinely rested. She went to bed with her phone and typically scrolled for 30 to 45 minutes before turning out the light. She ran warm because her husband preferred a warm bedroom, and she had stopped arguing about the thermostat years ago. Her last cup of tea of the day was typically at 9 in the evening, about an hour before bed. Every element of Josephine's sleep environment and routine was working against the glymphatic clearance her post-TIA brain needed most urgently. She was sleeping in the position with the least efficient glymphatic drainage. She was exposing herself to blue light stimulation until moments before sleep, preventing the melatonin release that supports deep sleep onset. She was going to bed in a warm room that prevented the body temperature drop that triggers restorative slow-wave sleep. And she was consuming caffeine within 2 hours of sleep, maintaining sympathetic arousal during the very hours her brain needed maximum parasympathetic support. We restructured her entire pre-sleep routine and sleep environment around glymphatic support. Over the following 3 months, she reported sleeping more deeply than she had in years. Her follow-up neurological assessment showed no new vascular events. Her treating neurologist noted at her 6-month review that her cerebrovascular risk profile was among the most well-managed of his post-TIA patients. The nightly habit that forms the center of this video is the one that Josephine found most immediately transformative. It was also the simplest, and it is the one supported most directly by the published neuroscience. The nightly brain habit that most directly supports glymphatic clearance and reduces the accumulation of stroke risk-associated brain inflammation is sleeping on your left side. A landmark study published in the Journal of Neuroscience used dynamic contrast MRI to visualize glymphatic flow in rodent models positioned in different sleep orientations. The findings were striking. Glymphatic transport was most efficient in the lateral, meaning side sleeping position, compared to prone or supine positions. The lateral position produced significantly faster clearance of amyloid beta and other metabolic waste products from the brain tissue. Between the two lateral positions, left side and right side, subsequent research has suggested that left side sleeping provides additional cardiovascular benefits through the inferior vena cava mechanism we discussed in an earlier video. With the inferior vena cava freed from compression, venous return to the heart is unobstructed, cardiac output is maintained efficiently throughout the night, and the cerebral blood flow that drives the glymphatic pulsatile pumping mechanism is optimally supported. The connection to stroke risk is direct and operates through 2 pathways. First, efficient glymphatic clearance removes the inflammatory proteins and cytokines that drive small vessel disease, the primary vascular mechanism of lacunar stroke and white matter disease. Second, optimized cardiac output during sleep maintains consistent cerebral blood flow, reducing the overnight periods of relative hypoperfusion that can trigger TIAs in people with existing vascular vulnerability. Left-side sleeping also reduces positional sleep apnea, which is among the most powerful modifiable stroke risk factors available. Sleep apnea produces repeated overnight hypoxia, drops in blood oxygen that trigger sympathetic surges, blood pressure spikes, and cardiac arrhythmias. Each apnea event is a stroke risk event. Sleeping on the left side reduces the frequency of airway obstruction compared to back sleeping, reducing the number of these events per night. This is the nightly brain habit, left side sleeping. It is not the only element of sleep optimization that supports brain health and stroke risk reduction, but it is the most foundational, the most immediately actionable, and the one with the most direct mechanistic evidence behind it. If you have slept on your back or your right side for decades, switching to left side sleeping is not as simple as deciding to. The body returns to its habitual position during deep sleep without conscious awareness, and many people wake to find themselves back in their familiar position after setting an intention to change. Here is the practical protocol that I recommend to patients making this transition. It takes 3 components, none of which require purchasing anything beyond what most people already have at home. First, the back pillow. Place one firm, full-sized pillow lengthwise behind your back when you lie down on your left side. The pillow should be firm enough to maintain its shape when you press against it during sleep. When your body attempts to roll backward during deep sleep, it encounters the pillow and either stays in position or rolls forward, which keeps you on your left side rather than returning to your back. Second, the knee pillow. Place a pillow between your knees. This serves 2 functions. It keeps your hips stacked in alignment, which removes the hip and lower back discomfort that causes many people to abandon side sleeping. And it prevents the top knee from dropping forward onto the mattress, which would pull the spine into rotation and create the back discomfort that is the most common reason people abandon the left side position before their body has adapted. Third, the head pillow height. Side sleeping requires a higher pillow than back sleeping to keep the cervical spine neutral, meaning your neck should be in a straight line with your spine rather than bent toward the shoulder or angled upward. If your current pillow is too low for side sleeping, folding it or adding a second pillow temporarily while your body adapts is preferable to sleeping with your neck in a position that creates morning stiffness and convinces you that side sleeping is uncomfortable. Give the transition 2 full weeks before evaluating it. The first 3 to 5 nights will feel unfamiliar. By night 6 to 10, the body begins anticipating the new position. By the end of the second week, most people stop noticing the change and begin experiencing the deeper sleep that the improved glymphatic function and reduced apnea events produce. Left side sleeping is the foundation, but there are 4 additional habits that either maximize or undermine the glymphatic clearance that left side sleeping enables. Understanding them turns a single behavioral change into a comprehensive nightly brain protection protocol. Supporting habit 1 is screen abstinence in the 30 minutes before sleep. The blue wavelength light emitted by phone, tablet, and television screens suppresses melatonin secretion by the pineal gland. Melatonin is not only the sleep hormone, it is a direct regulator of the deep, slow-wave sleep stages during which glymphatic activity is highest. Suppressing melatonin with screen exposure until the moment before sleep reduces the depth of slow-wave sleep, which directly reduces glymphatic efficiency. The intervention is a 30-minute screen-free window before sleep. Not an hour, not a dramatic lifestyle change, 30 minutes. During those 30 minutes, dim the lights, avoid stimulating content, and allow the melatonin system to begin its natural rise. For Josephine, this single change was the one she described as having the most immediate impact on her subjective sleep depth. Supporting habit 2 is bedroom temperature optimization. The body's natural temperature drop during sleep initiation is one of the physiological triggers for deep, slow-wave sleep onset. A bedroom that is too warm prevents this temperature drop, delays or reduces slow-wave sleep, and consequently reduces the time during which glymphatic clearance is most active. Research consistently finds that a cool bedroom temperature, in the range of 60 to 67 degrees Fahrenheit or 15 to 19 degrees Celsius, supports deeper and more restorative sleep than warmer environments. Supporting habit 3 is caffeine timing. Caffeine has a half-life of approximately 5 to 6 hours in most adults over 60, meaning that a coffee consumed at 3 in the afternoon is still half active in the brain at 8 or 9 in the evening, suppressing adenosine, the sleep-promoting neurochemical, and delaying the onset of slow-wave sleep. For people who are serious about optimizing glymphatic clearance, the latest caffeine cutoff is early afternoon. 1 o'clock is the recommendation I give patients who report light or unrestorative sleep and who are consuming caffeine in the mid to late afternoon. Supporting habit 4 is the 2-minute bedtime breathing routine we discussed in a previous video. The 4-7-8 breathing technique activates the parasympathetic nervous system and reduces cortisol and sympathetic arousal as sleep approaches. Lower sympathetic arousal at sleep onset supports faster entry into deep, slow-wave sleep, which maximizes the nightly window during which glymphatic clearance is at its most active. The breathing routine and the left side sleeping position work together as complementary components of the same nightly brain protection strategy. I want to spend a moment on the longer-term evidence for why nightly brain habits compound into meaningful stroke and dementia risk reduction over years and decades. Because the one-night impact of any single habit is less visible than the cumulative impact of that habit performed consistently over time. Research on sleep duration and quality in older adults has found consistent associations between short sleep duration, defined as less than 6 hours per night, and elevated stroke risk. A meta-analysis of prospective cohort studies found that both short and long sleep duration were associated with increased stroke risk, with the optimal duration for stroke risk reduction falling between 7 and 8 hours per night. Research specifically on glymphatic function and cognitive outcomes has found that people with better objective measures of slow-wave sleep show slower rates of amyloid beta accumulation in the brain over time, which is directly relevant to both dementia and cerebrovascular disease risk. The glymphatic system's nightly work is not immediately visible, but it is cumulative. Every night that the system clears efficiently is a night's worth of reduced toxic protein accumulation. Every night that it is impaired is a night's worth of accumulation that stays. Over 10 years, the difference between consistently efficient and consistently impaired glymphatic clearance is not trivial. It is the difference between a brain that arrives at 75 with manageable vascular inflammation and protein accumulation, and one that arrives at 75 with a significantly higher burden of both, and a correspondingly higher risk of the cerebrovascular events that protein accumulation and vascular inflammation drive. This is the long-term case for a nightly brain habit, not a dramatic intervention, a consistent, small, nightly investment in a biological process that does its most important work while you are unconscious, and that compounds its benefits over years in ways that are impossible to see night by night, but that show up clearly in the brain health statistics of older adults who have protected their sleep as carefully as they have protected any other dimension of their health. Let me give you the complete nightly brain protection protocol in a sequence that you can begin tonight. At least 30 minutes before your target sleep time, turn off all screens. Dim the lights in your bedroom. Allow your melatonin system to begin its natural rise without suppression from blue light exposure. Set your bedroom to a cool temperature, ideally between 60 and 67 degrees Fahrenheit. If you share a bed with someone who prefers warmth, an electric blanket on their side and a lighter cover on yours can be a practical compromise. When you get into bed, perform the 4-7-8 breathing routine. 4 counts in, 7 counts hold, 8 counts out. 4 full cycles. This activates the parasympathetic system and reduces the sympathetic arousal that delays deep, slow-wave sleep entry. Turn to your left side. Place the firm pillow behind your back. Place the second pillow between your knees. Adjust your head pillow height so your neck is neutral. That is the complete protocol. Screen abstinence, cool temperature, 4-7-8 breathing, left side position. 4 elements, fewer than 5 minutes to implement, and a nightly impact on glymphatic clearance, brain inflammation management, and stroke risk reduction that compounds beneficially over every night it is practiced. I want to hear from you in the comments today. Before this video, had you ever heard of the glymphatic system? And after watching, which element of the nightly brain protection protocol are you most willing to start tonight? Your honest answer helps me understand what my community knows and what I need to explain more clearly in future videos. If this video gave you something that genuinely changes how you think about what your brain is doing while you sleep, please share it. Share it with everyone in your life over 60 who has never thought about sleep as a brain health intervention rather than simply a rest period. That reframing is worth sharing. It changes how people prioritize sleep, and better prioritized sleep changes outcomes in ways that matter enormously over a decade. Subscribe for more honest, research grounded conversations about protecting your brain and cardiovascular health after 60. Next time, we are going to talk about 5 things that are happening in your brain right now that your doctor has never mentioned. It connects directly to today's conversation about glymphatic function and gives you a deeper understanding of the silent changes that occur in the aging brain and what you can do about them.